Welcome to the Nano podcast. I'm your host, Will Chernlin, and I'm excited to have you join me on this journey through the world of nano-cap companies. For the past decade, I've talked to thousands of business owners across various industries. It's been an enlightening experience revealing the vast tapestries of entrepreneurship and innovation that thrives beneath the surface of mainstream media coverage. Each week, I will interview different leaders of nano-cap publicly traded companies to learn about their history, what they do now, and their future. As a reminder, none of this information is financial advice, and it is all for entertainment purposes only. Let's start this week's episode. Hi, everyone. This week we have Ben Hwang, the CEO and chairman of Profusa, stock ticker PFSA. Profusa is leading development of injectable biosensors with the goal of transforming personal and societal health and wellness by making our body's chemistry more accessible. Ben, thanks for coming on the show.
Hey, thanks for having me, Will. It's a pleasure.
So I start out almost always going through people's LinkedIn, kind of seeing about their past and how they got to where they are to today. I would love to hear some stories about you while you were, it sounds like in college, working for the Dodgers while they went on their World Series run in 1988. Tell me a little bit about just what it was like being part of the championship culture and how much fun that must have been.
Yeah, I'll tell you, Will, to be honest, my biggest fear in life when I was younger was that my life had peaked at the age of 18, because it really, as a baseball fan, it really doesn't get any better than being on the field at Dodger Stadium, shagging fly balls with your heroes, and then getting up close and personal, learning how to throw a curveball from Sandy Koufax and Bob Welch, and messing around and goofing off with Orel and Gibby and Saxey. I got really lucky. My life is just full of one fortunate event after another. If I were to take credit for it, it's just I took advantage of those lucky breaks. And I was introduced through a friend of my father's to somebody that's associated with the Dodgers, and that translated into from asking for an office job into being a bat boy, into interpreting for Mr. O'Malley, who's the owner at the time, for some baseball exchange with coaches from China. And that parlayed that into a entry-level front office job in the publicity department and marketing department. And I'll tell you, it really was a wonderful ride. You work hard in professional sports, but there are so many stories and so many experiences that I still treasure today, including my World Series ring, that Mr. O'Malley was generous enough to actually provide to the front office staff as well. So it was really a fun ride. But I think more importantly, because at a young age, I was exposed to stars and different personalities and high pressure and sort of high visibility folks. I think some of those experiences and the skills that I learned to navigate that has served me well for the rest of my life.
Yeah. So for a lot of people, the peak of their life may be hanging out with Sandy Koufax after winning a World Series. For many other people, it may be getting their MD from Johns Hopkins. So tell me a little bit about that. So you're working in the front office. You're like, this is the best job I've ever had since I was a kid. But am I going to work in the front office forever? Did you have pressure from your family being like, all right, no more having fun, time to move on? Or how did that kind of work out?
Yeah, without disclosing, and boring your audience with too many details, I was actually in many ways forced to go back to school by myself, by my thinking, because of the working at Dodger Stadium and the games finishing so late and needing to make some money. I never finished high school. And so I was a high school dropout, quote unquote, always had aspirations going back to school. But because the Dodger experience was really so fun, by the time I got to 23 years old or so, I realized I really needed to make a commitment, either through, being at the Dodgers for the rest of my life and understanding that that's probably the only organization I could ever be a part of without an educational pedigree, or I just have to bite the bullet and say, okay, I'm going to go back to school and pursue something else. It was a very difficult decision, as you can imagine, because it was a pretty cool job. But it was ultimately the right one that I chose for myself. So I left Dodger Stadium at the age of 23 because I didn't have a high school diploma. I was basically starting from a fresh slate. And so I went to community college, Pasadena City College in Pasadena, California, right next to Caltech, and got my GED, took the SAT, and then from there went to USC for a semester, and then ended up at Johns Hopkins. And by the time I was at Hopkins, I was 25 years old or so as a sophomore. Um, so it's pretty old sophomore, and had to make a decision what I'd want to do. I really liked the sciences at the time. In my time at Caltech, I ran across Dr. Lee Hood, got really interested in the sciences, and then just stayed at Hopkins and ended up getting my PhD, not my MD, but my PhD.
Oh, sorry.
Yeah, it's all right. I'm called a doctor, but I'm just the kind of doctor that can't give shots. But so I got a PhD and got really fascinated with the world of science, the impact that science actually could have in the world, and just decided to make that a career of mine.
Yeah, and one of the questions I kind of planned on asking, but you almost kind of answered yourself, is that a lot of times when I talk to people who get into like medical and PhD type biology type stuff, is that they tend to get almost like sucked into academia for about 10 years afterwards until they finally go, okay, I want to do something else with it. You were able to kind of get out of academia almost immediately, but now it makes so much more sense in retrospect, since you weren't the person who spent all high school trying to get the best grades to then get into the next school, then get into the next school. You had cut your chops in the workforce, and so you're probably chomping at the bit to get back into the workforce.
Yeah, well, it's a really interesting point. I think once again, it's one of choices that I made where the circumstances actually forced me into making that choice. Back then, I'm dating myself. This is in the '90s, and in the '90s, if you were in academia, the cultural pressure was for you to stay in academia, because the notion was your PhD work is funded by National Science Foundation, funded by NIH, funded by taxpayer dollars, and you shouldn't go out in the private sector, and you should give something back to the scientific community, if you will. But really, I was not a very good bench scientist. I think I have all the admirations in the world for people who actually are so intellectually curious on one single problem that they would spend 10 years trying to figure it out. For me, I wanted a little more fast-paced action, a little more reward for the work that I actually put in. And so I knew I wasn't going to be very successful as an academician. I love teaching. I love talking to people, but it wasn't the career for me. And so I had an opportunity. McKinsey came on campus to recruit. I was applying to business schools, and it kind of set me off on a different trajectory where I could have the best of both worlds. I could actually be absolutely involved and hopefully influence and contribute to the world of healthcare and health technology, meanwhile participating in a career that actually is more aligned to my personality.
And just to kind of, before we move on from here, I'm just curious from like a personal point of view of, I don't know if it was much different back then than it is now, but did you carry much stigma as like the 25-year-old sophomore? Once you kind of got past a certain point, you got to your PhD, McKinsey's like, your story's interesting enough. You got a World Series ring and a PhD. Not many people can say that. I don't really care how old you are.
Yeah, I think it's probably more the latter. At some point, age stopped being an issue other than myself. I put pressure on myself because I was anxious to get started in my career. But once again, like I said, I was fortunate. I was fortunate that I didn't drop out of high school and spend my time, goofing off, right? I at least semi-useful and productive use of that time, gain some skills, gain some experiences. Although for a while in my career early on, it may be of interest or not, but early on in my career, there was a period of time where I had to really explain my resume, because if you see my CV or resume, it's just a master's degree and PhD from Hopkins. There's no mention of what undergraduate degree and what high school I went to. And so that's always an interesting conversation.
Yeah, and it seems like more and more people nowadays kind of lean into the eccentric CV, and they like the idea of the guy who's dropped out of Harvard or Stanford after 1 year because they got this idea, and that's a little bit more appropriate. Where I can imagine in the earlier '90s and stuff that it's a weirder story to try to tell people and have them fully kind of follow along.
Yeah, Yeah,
Oh, go
I would
ahead.
agree. No, sorry, Will. I would agree. I will say though, listen, I have three children now, and I would not advocate my path for any of them because I do feel like in many ways I did miss out on the normal, healthy growth of a young person. I think the college experience offers a lot of really wonderful memories and opportunities to make friendships and such that I might have missed out on. So, you know, I'm happy with what I made out of it, but I wouldn't advocate it for everyone.
Okay. You at least get to hold it over their heads for a while, saying when I was your age, you wouldn't imagine I was sitting there, cleaning out spit buckets and stuff.
That's right.
Um, so as you mentioned, from there, after you graduated, moved on to McKinsey and then a couple other places. And then you started consulting almost like over a decade ago, I think now, at Profusa. Was it still the same idea that it is now? Has it transformed over the years? How did you get in contact with them? What excited you about them? Just kind of tell me kind of the intro story of how you got exposed to Profusa.
Yeah, sure. One of my former colleagues at McKinsey was a co-founder of, well, at least have an idea, the scientific idea, and co-founded the company. And she had reached out to me because of my sort of business background by then. I had a couple of decades in the health industry. So I joined the company as a founding CEO. Started as a consultant only for a few months just to see if the fit was right. And then became the founding CEO and part of the founder group of the company. And what attracted me with Profusa, so so that your audience understands, and you have to rewind the clock probably, 12, 13 years or so ago. If we recall 12, 13 years ago, there was this big push on technology, the miniaturization of technology. The iPhone was actually coming online. And the fascination or at least the goal and fantasy, if you will, was if you gather enough data, if you have enough data around you, can you apply the same real-time insight to healthcare that was available for, going from point A to point B via Maps application or Amazon and real-time pricing, et cetera. And having real-time information at your fingertips really changed the way we live our lives in so many ways, except for healthcare. And the idea was there were many shots on goals, great companies with great technologies, the Fitbits of the world, if you will, that where the hypothesis was let's generate a lot of data and then let the machine learning and the algorithms figure out what it could actually do for personalized medicine. I think we took that concept and built off of that and just went one step further. And what we recognized early on was, data for data's sake is in healthcare is not the same as data in commerce. If you early stages of a e-commerce site like Amazon, prices misquoted, somebody stole your credit card number, et cetera, something bad happens, you undo the transaction and no harm, no foul. In healthcare, on the other hand, you can't make a mistake because if you do, you could have catastrophic outcomes, especially at least the real high value clinical decisions. And it became very clear to us that in order for healthcare to be changed with real time information, what you have to gather are data that doctors care about so that they could make the high value decisions. But if you commit to doing that, then you have to have clinically validated ways of gathering that information, going through clinical trials, going through really rigorous testing and validation so that you could be confident and the doctors could be confident or a user could be confident that the data means something, right? That if you're reporting 120 mg of deciliter of glucose, you are at 120 mg of deciliter in glucose and you could trust that for a therapeutic decision. And so that was really the initial kind of thinking. That can we develop a technology that actually creates that stream of biochemistry information at clinical grade accuracy so physicians could count on. But in order for you to have broad appeal, the usability has to be delightful. So your user experience has to be very similar to wearing an Apple Watch or wearing just some, Whoop band or whatever it is that's very useful, easily used. And then the cost basis cannot be a medical device cost where you have to be dependent on insurance to pay for it. You have to be at a consumer-based cost where $20, $30 a month is more than enough to actually be able to have access to that technology. And if you could get all three, clinical accuracy data in real time, usability that's delightful, and cost basis that's actually really attainable for anyone regardless of your insurance condition, then truly then you could bring to bear a solution that is aligned with what people thought about as far as a vision is concerned for healthcare as well, similarly to commerce and, roadmaps, etc. Now, the additional benefit of this is once you generate all of this data, right? If you have tens of millions of people using a platform like this, as opposed to just a few million, the way it is today as a medical device, and then you could have a bunch of people using it for various different conditions, as opposed to just for diabetes. And if you could actually have a bunch of people across the world with different genetic profiles, and truly that data becomes the input for all of the great artificial intelligence engines that are actually out there to be able to calculate and be able to give insights off of the learnings of the hundreds of millions for a particular individual. And so from that perspective, we think our technology and technology platform has a great place in managing chronic disorders, which are really, really, unfortunately, large markets. And we can't wait to actually be able to help those patients live better lives. But I think actually transform the entire conversation about how healthcare should be monitored and what insights could be had and what preventive measures could be taken, because all of this data is now available that's never previously been available before.
Yeah, it must have been tough in the beginning years if people didn't see the vision that like continuous glucose monitoring can be applicable to everyone, not just people with diabetes, and that inflammation's inflammation. Your body's telling you something when your glucose is spiking when you eat one ingredient over another. Was AI, machine learning, getting everyone to get on glucose monitors, continuous glucose monitors, opposed to just people who need them to live day to day? Was that all in the beginning thesis, or were those kind of things that you almost like fell into over time where you go, okay, hey, there's this quantified self movement and all these athletes are now monitoring their glucose. Let's talk to these people. Oh, actually, more and more people want to know what their data is up to because they want to enter it into ChatGPT. Like, as these things kind of happened over time, did you guys just kind of keep your sail and just make your sail bigger as the TAM got bigger? Or did you have to kind of pivot a little bit to be like, okay, we are going to just focus on oxygen and glucose because those are the two that tell us the most information, and the other ones will be down the line? Or kind of tell me how the 13 years or 12 years is a long time to be running a company. Tell me about kind of how that ship navigated all these different headwinds and tailwinds combined.
Yeah, it's a really interesting thought. So if I were to look back, I think what gave me the conviction of the company and our technology was that mission, or at least that vision, never changed. I think it takes a little bit of conversation and it takes a little bit of explaining, but after a short dialogue, I think the vision of having all of this real-time data, as opposed to once a year you get a blood test, but having all that data coming out continuously. And our platform is one that oxygen and glucose are our first two programs, but it is a platform. We have a long tail and pipeline of other analytes that we've actually looked at varying stage of development or readiness. It is a platform. And so, and the fundamental premise of starting a company where we could build a technology that's easy to use and low cost was a fundamental thesis from the very beginning. So I think it's important for any entrepreneur, and definitely for me, and that you have a mission and you have a vision that you could align to say, hey, this is worthwhile, and accomplishing this mission and vision might take decades to come to fruition, but everything kind of start with first step. If you're aligned to that vision and really clear to it, clinical grade accuracy, wearable, that's delightful to the user at very low cost, and you could articulate what that potentially can mean, then you're absolutely right. As we develop the technology and going along in our journey, you have to demonstrate tangible steps. What could be acquired? What could be accomplished now? What are you taking by faith that AI or microelectronics or processing power will catch up in 2-3 years? What the optical filtering system advancements are in 2 years, 3 years, what's going to be available? And you make those adjustments based on your context and what other tools are available. One of the things that have stuck with me, and the reason I believe in this future so much, is you had mentioned that I was at Caltech for a little bit in Dr. Hood's lab. So I was very fortunate in the summer when I was at Pasadena City College. I knocked on doors to try to get a summer job, and I ended up landing a a small role, a job in Lee Hood's lab. And for those of you who don't know Lee Hood, great guy, incredibly smart, accomplished scientist, one of the legends in the biotechnology fields. But his accomplishment when I joined the lab was the automated DNA sequencing machine that his lab had developed. And so, without going into technology, with his instrument, DNA and the human genome was solved within years of the introduction of that technology. Before that, solving the human genome was an impossibility. And now that the human genome is solved, the cost of sequencing and the amount of DNA data and sequencing data just exploded. You can't
There's
think
a
about
company called Nucleus. You can do it for like $75 now.
That's right. And by the way, you don't touch, right? You can't touch therapeutics. You can't touch any meaningful questions around healthcare and medicine without touching on sequencing, without touching on the DNA foundation, right, of the disease or the solution. You don't have biosimilars without DNA sequencing, et cetera. I mean, it's just incredibly expanded our ability to make people's lives healthier. And if you take all of this after impact, right, and then distill it down to the kind of time zero, if you will, it was that DNA sequencing machine that made all of that possible. And it was embedded in my head early on that a fundamental technology that's developed can unlock something incredibly special, not just for that particular company, but actually for the world. And using that as an analogy, I truly believe that Profusa's technology could be that seminal technology that creates the next evolution, which is all of this real-time data that could be linked to your choices and your therapeutics decisions that your physician put on you. And if that could be actually propagated among hundreds of millions of people, not only can you manage your disease better, but I think you can actually open up an incredible path of insight that could change healthcare for the better, which I think the world absolutely needs right now.
So before we move on to Bitcoin, I would love just to hear a little bit more about like kind of the hardware versus the software side of Profusa and what you're working on. How much of it is you all trying to just make the device as small and as accurate as possible so that it's as easy as to live with? And then how much are you all focusing on almost just like the research side of thing and collecting all this big data and making sense of it and providing value on that side of things? And how do you kind of weigh both sides of that?
Yeah, you have to start obviously with getting the data first. And so there have been many shots on goals, if you will, by other efforts on how to get real-time biochemistry information out of the body that's reliable, that's clinically validated, with delightful user experience and lower cost. Lots of shots on goals. We've kind of solved that issue and solved that problem with you, if you will, with our oxygen sensor that had received CE approval. We're now just migrating to the new MDR standards that will be on the market. It's been in more than 100 patients so far through clinical studies, and it'll be on the market first quarter of next year. You start with making sure that the technology and the platform itself will give you the data that you actually need, and then you gather enough of that data to start learning from it and build the AI model for the so what, if you will, the latter part that I actually talk about. So I would say right now, vast majority of our effort is to making sure that the data that we get is sound, robust, commercializing that product so that we can start getting users on it. But the vision, though, for how that data could be used in the larger setting, I think that vision is pretty clear and the path is pretty clear. We just have to take it one step at a time.
So as you wrap up here, I got to ask about your new Bitcoin treasury announcement. And just curious, like, who first came up with the idea internally? How long does it take to execute something like that from idea to like actually being able to launch it? And what are the expectations?
Yeah. So listen, we are a new public company. And I think there's some muscle building that goes along with, and bodybuilding that goes along with going from a private company and going through the journey of becoming public and then being out on the market. A lot of benefits, but also a lot of growing lessons to be had. One of the lessons that we actually kind of coalesced and crystallized for us is this idea of treasury management, right? To create shareholder value, not only do you want to generate enough resources and stockholder support for the company. But you also want to make sure that whatever cash you actually have in hand, you manage that efficiently, but also manage it for growth and shareholder value creation as much as you can. We're always looking for ideas on how to run our companies better. And I can't remember exactly who came up with that idea, who threw it in our way. But it's just through kind of scanning what's going on, thinking that, hey, this strategy makes sense. It makes sense because it hedges the cash fluctuation. It hedges the inflationary and debasement pressure that's going on out there, and the erosion of buying power. It makes sense, actually, is we think we have a really interesting and fundamentally great story to tell. I think the Profusa as a company is worthwhile supporting. But creating a Bitcoin treasury strategy, I think, opens the eyeballs of other pools of investors to look at our story. And we think that's, obviously not just from a financial support perspective, but I think it's a good story that everybody should know because we're all touched by somebody in our circle that could benefit from a technology like this. And so very quickly, we looked at it and just realized that there are a lot of upsides to this. It helps us manage our money smarter. It helps us capture some upside on the cash that we actually have on hand. And it also creates an opportunity for us to tell our story to a pool of investors that may not be normally engaged to it. It was a pretty easy decision to make.
And yeah, did you need any convincing, or were you already pro Bitcoin? You said, "Hey, I've been waiting for someone to ask me."
I was more in the middle. I'm not an expert in Bitcoin. I am now, but I wasn't, and it took a lot for me to get smart on it. I knew enough to be dangerous, I guess, to say, hey, this is something that's probably worth looking into. And like any evolution of a leader, you keep an open mind, you keep your eyes and ears open, you learn as much as you can, you take the right counsel from the right people, and then you make the synthesis of it. So I wouldn't say that I needed to be talked into it. It was an opportunity that we evaluated and ultimately came to what I believe to be a right and sound decision for the shareholders and for us. Yeah.
Very cool. So 5 years from now, everything goes perfect. I know you can't say too many forward-looking statements, but where do you see Profusa? Where do you see yourself? Are you looking at trying to scale the consumer side of things and getting into stores and with gyms and trainers? Are you trying to measure 5 more different biomarkers? Kind of where do you see the path and what excites you?
Yeah, I think it's a little bit of both. I think our mission is to be able to serve as many people as possible, as quickly as possible, because ultimately we're tied to making people's lives better. If one of the reasons that I got into this and one of the reasons that I continue to actually be committed, invested in this mission is, like I said, we all have friends who have folks that in their lives that could actually benefit from the technology. And, myself, in my personal life, Lily Griffin, Evan Palmer, and others that are just part of our journey that we keep focused on all the time. And we make decisions, we get committed because of people like Lily and Evan. And when we think about this, it naturally translates to over the next 5 years, our mission is going to be how do we create a universe where our technology is accessible and available to as many people as possible. Now, what does that mean? Well, it means in the first few steps, it's around clearly defined products and clearly defined markets that we could go into. Peripheral arterial disease, critical limb ischemia in the area of oxygen, the Lumia oxygen platform, diabetes management for type 1, type 2, and pre-diabetic patients in the glucose product that's coming out in about a year and a half. And on top of that, any of the opportunities that actually exist, and some of it will be opportunistic and some of it will be planned, we will take advantage of as long as it actually makes sense for the company. But really the guiding principle is, how do we get as many people to benefit from our technology as quickly as possible? Because I think shareholder value and all the other metrics will come from that as long as we accomplish that mission.
Well, Ben, thank you so much for coming on the podcast. If people want to learn more about what you guys are working on, where should I send my audience?
Our website is profusa.com. and they could actually reach out to us, info@profusa.com, and we have somebody manning it, and we'll be in good shape.
Great. Stock ticker is PFSA. For those of you still listening, please remember to subscribe and review. Thanks.
Thank you, Hwang.
This podcast is for informational purposes only and does not provide financial, legal, or any other advice. The information is not investment advice or any offer to buy or sell any securities or to make any investment. The views expressed by the guests are their own, and any reference to third-party products, services, or information does not constitute an endorsement, therefore, by NanoCap Podcast or its affiliates. The NanoCap Podcast Express disclaims all liability for any individual's use of the information presented